Thank you for having me. Good afternoon. I'm Jennifer Pomeranz. I will be speaking about changing demand in this current food environment, which we all know is filled with highly processed, highly sugared products. So demand is a function of consumer preference as shaped by taste, marketing, information. It's a function of income, cost, and also availability of substitutes. The good news is that there are a high availability of substitutes. We all know that the substitute for highly processed, highly sugared foods is whole foods, nuts, beans, eggs, real food, vegetables. The problem with it is that it's not highly marketed, it's often more expensive and sometimes less accessible. So in the current environment, also, the cost of these highly processed foods is a lot cheaper than whole foods. So this is a graph of highly sugared foods are consistently below the consumer price index, whereas vegetables and fruits are consistently above the consumer price index. And anyone who's gone shopping knows that healthy food is often more expensive than unhealthy food. It's always cheaper to add a bag of chips to your sandwich than it is to get a side salad. So in this environment where it really fosters poor nutritional choices, how do we change demands? And I would like to talk about information and two aspects of information which I think can help change demand. The first is that food companies are also creating what are called better-for-you products. Now, the good news, people are buying them. A report came out last week that 39% of processed food products are actually better-for-you products. But the news is that it's driving 70% of the sales. So what's happening is the better-for-you products are driving a majority of the sales. The reason this is good news is it means people are actually listening to the fact that the public health nutrition community is telling them to eat better. The bad news is this is not good food. It's better for you, but it's not actually healthy. So I think my job as a public health lawyer is to correct information disparities, and our current society is full of them. I'm going to give you an example to show you what we face as public health lawyers on a daily basis. A few years ago, a couple courageous cities and states enacted what are called menu labeling laws. These laws require fast food restaurants to put calories or other nutritional information on their menu boards. At this time, some states enacted preemptive menu labeling laws, which actually preempted the ability of local jurisdictions to pass menu labeling laws, thereby cutting off information to the consumers. To make matters worse, at this time, the National Restaurant Association led a nationwide campaign to pass what are called Personal Responsibility in Food Consumption Acts. These acts, they're also called cheeseburger bills, block civil litigants from being able to sue fast food restaurants for claims such as diabetes or obesity from eating their foods. Now, no matter what you think of this litigation is irrelevant. The problem is that some states that passed the preemptive menu labeling laws also passed Personal Responsibility in Food Consumption Acts. Thereby, they're telling you to take personal responsibility in the food you consume, but we're going to block the ability of your local jurisdictions to require restaurants to tell you what's in their food. This is a complete contradiction to taking personal responsibility if you can't get the information. And as a public health lawyer dealing in food policy, this is what we're dealing with on a daily basis. So let's correct the information disparities. Let's all agree, we've heard it all day today, and the science is clear, sugar is a problem. Added sugar in the American diet is a direct contributor for cardiovascular disease risk, diabetes risk, weight gain, obesity, and micronutrient dilution. Let's be clear about it and get the word out. And so let's ask the FDA to require food companies to label added sugar on their products. It used to be thought of that we couldn't do this because we didn't have the ability to detect it, but we do now. We have the scientific ability to detect added sugar in food products. We require tobacco companies to submit their proprietary information to the FDA. We can require food manufacturers to do the same if they don't trust us to test if we can't trust them to disclose the amount of added sugar in their products. But meanwhile, it is against the law to introduce misbranded products into the marketplace. So by law, they should be able to disclose factual information about their own food because they know how much added sugar is in their products. Let's increase the let's ask the FDA to require a daily recommended value of added sugar so people have guidance on what to eat. Right now, people have very little guidance. In 1990, the World Health Organization said that warned against eating a diet too high in added sugar. The American Heart Association recently came out with levels of sugar consumption. Americans are far exceeding these levels. If the FDA has daily recommended values for other nutrients in our diet, they should be having one for added sugar as well. The reason why increased labeling is helpful is because it leads to informed consumer decision making, but it also results in reformulation. So it actually ends up saving lives for the people that read the label and the people that don't. Also, let's ask the FDA to have a disqualifying level of sugar to be able to make a health or nutrition claim. Currently, the way food products are now, you have a character smiling at a child, enticing them to ask their parents for the product, and a health and nutrition claim on the same product that appeases a parent who otherwise would not have purchased this product. We have disqualifying levels of nutrients for sodium, cholesterol, and other nutrients. We should have one for added sugar too. On the subject of health and nutrition claims, they're misleading. 50% of consumers find them confusing. Some of them are not based on science. The FTC and the FDA have gone against some of these companies that do put out claims that violate the regulations or are not based in science, but we need to give the agencies the ability to actually do more. It's time that we start fining companies for making questionable claims on our products, so it's actually more expensive to make questionable claims than test them in the marketplace and get caught by the agencies. And let's support and encourage our attorneys general to get involved. A couple very terrific attorneys general have gotten involved in consumer protection on the food front. It's part of their mandate to protect consumers. Let's ask and encourage our attorneys general to get involved in this topic. Now I'd like to turn to the subject of food marketing. The First Amendment of the United States Constitution says that the government shall make no law abridging the freedom of speech. Originally, this was conceived of so people can contribute to and listen to ideas in the marketplace. It was for purposes of self-determination and government. In the 1970s, the US Supreme Court determined that the First Amendment should protect commercial speech. This is advertising and marketing. The food companies have decided that it's okay, based on this, to market to children. The Supreme Court has interpreted the protection for commercial speech more and more strictly as the years have gone on, but they've actually never decided a case on marketing directly to children for products that children can purchase. I'm going to give you an example of an analogy of what I think is going on in the food marketing to children area so you understand what we're dealing with. Pretend you're a shoe salesman. Parent and child comes in. You measure the child's foot. You tell the parent the width, the length. The parent makes a decision based on the information which shoe to buy. I think that was nutrition education 50 years ago. Now we're in a situation, the shoe companies are directly marketing to your children. They're telling your children shoes that are 3 sizes too wide for their feet are really cool and they have to have them. For market forces beyond the parent's control, these shoes happen to be cheaper and they're available in every corner store. As I explained earlier, information is not getting to the parent. And guess what? The kids love them. They love these too wide shoes. They beg their parents for them. But you know what the companies tell the parents? It's up to you to make the right decision. We're just giving consumers what they want. That's what we're dealing with food marketing. The food marketers are targeting our children, and unfortunately, most parents don't actually know the extent this is going on. There are websites directed to young preschoolers to brand fast food restaurants directly to them. Something called advert games, where kids are playing with ice cream and cookies and chips. These are by companies who actually profess not to market to children. There are commercials, we know, there's ads in schools, the front of packaging and retail, no company even pretends to not engage in that kind of marketing to children. And you know what? Marketing actually works. It works on all of us. If I say snap, crackle, and pop, you know exactly what I'm talking about. But the worst part is it works on children more. First of all, they don't know or can't comprehend the health consequences of eating ice cream every day. The second thing is young children, under 8 particularly, do not understand persuasive intent. They actually take everything marketers say as fact. So I would say that that's an inherently misleading and deceptive way to market to children if they don't actually know that they're being marketed to. The Supreme Court found that the government had a right to protect vulnerable accident victims from lawyers trained in the art of persuasion. Clearly, we can agree that we should be protecting vulnerable children from marketers trained in the art of persuasion. At a minimum, let's get the marketing out of schools. The CDC just reported that 50% of middle and high schools have food marketing in them. At a minimum, let's get the marketing out of schools. The government did try to work with industry to come up with some voluntary guidelines that they thought would go well with the nutritional guidelines to ask marketers to please voluntarily market their food according to these guidelines. And oops, that's the wrong slide. So I showed you the wrong slide last time, huh? So this was the slide. Oh, what happened to my slide? Okay, it's gone. These are not my slides. But anyway, so what happened was so it must be the next slide. So the industry said there are no middle grounds, we're not compromising. So the government did try. Now, based on the fact that industry won't compromise, I think we have to do what the Supreme Court suggested in some tobacco and alcohol cases. When the government tried to restrict marketing to young children for tobacco and alcohol products, the Supreme Court said adults have a right to hear this information. So why don't you do this? Why don't you regulate conduct? Regulation of conduct or behavior or marketing practices does not go against the First Amendment, and the Supreme Court suggested a few. The first, raise prices. The idea of a sugar-sweetened beverage tax is being floated around everywhere, and it's not so crazy, let me tell you. 2 years after the Constitution was ratified in 1791, the federal government passed the nation's first excise tax on whiskey. But there was a whiskey rebellion, right? Yeah, it didn't matter. The government just passed more excise taxes. They didn't repeal the whiskey one. Alexander Hamilton said the tax would be to diminish the consumption of this national extravagance. Clearly, we know that sugary beverages are a national extravagance. First of all, we know that they're an independent risk factor for heart disease, diabetes, weight gain, and obesity. And also, human beings don't compensate for sugar beverages, meaning they don't eat less when they intake their calories through sugary beverages. It's a perfect target for the first excise tax. And the great thing about excise taxes is that you can actually earmark the funds for health purposes. Currently, we have excise taxes on a lot of products, tobacco, coal. These are earmarked for infrastructure, education, and health. We can earmark these excise taxes to support public health in communities that are suffering from social and economic and health disparities. The other ideas that came from the Supreme Court: limit per capita purchase, age limits to purchase products, limit harmful ingredients. Clearly, we could start restricting the amount of sugar that are allowed to be in products to begin with, and especially those to be allowed to be in products for children. Restrict access in and near schools. Clearly, we should be having schools that are junk food free, and we should also consider enacting zoning and condition licensing agreements to get corner stores from around schools to not be offering these types of products. Fundamentally, this is an issue of social justice. We can't educate our way out of this one. It's impossible to tell someone to eat an apple and expect them to buy an apple when it's much more satiating and cheaper to buy an entire meal at a fast food restaurant. Let's also do some reverse marketing. The Truth Campaign did have an impact in tobacco. Let's denormalize the fact that a clown is telling our children what to eat. In conclusion, I believe that when the product is beyond the ability of an individual to deal with, when we're limited by an environment that fosters very unhealthy decisions, when it's cheaper and more convenient to purchase unhealthy products, and when it's cheaper and more profitable to produce them, we need the government to get involved. And on this note, the Supreme Court decided the case of Citizens United, giving corporations the ability to make political speech. This means that they can defeat our elected officials, well, they can try to defeat our elected officials with campaign funding who support public health. So they need our support more than ever. Elected officials that stand up for public health need our support. So Marion Nestle said to vote with your fork, but I also urge you to vote with your vote, because real change really requires real change, and we cannot live with the status quo as it is. Thank you.